today we're going to be assessing hip flexion manual muscle test. You're going to have your patient in the short seated position. And the agonist muscles that we're assessing is the psoas major and the iliacus, which together make up the iliopsoas. Hi Matt, my name's Ella. I'm a student physical therapist assistant over at Clarkson College. Is it okay if I work with you today?
Yep.
Excellent. So we're going to be assessing your hip flexion manual muscle test today, okay? So what I want you to first is to perform a hip flexion. So what that means is you're going to drive your knee up to the sky, okay? So go ahead and lift, excellent, and right back down. Perfect. Now I'm going to support you here at your pelvis, okay? And I'm going to have you meet my hand, and then I'm going to apply a resistance, and I want you to stay right where you're at. I don't want you to let me push you down, okay? All right. Good, meet my hand. Good, and hold, hold, hold. Good, excellent. And as always, test bilaterally. So we're gonna go ahead and test your right one. So go ahead, again, knee to the sky, go ahead and flex. Excellent, good, right back down. Good, I'm gonna support you here. Good, meet my hand, and hold, hold, hold. Good. That will be a test for hip flexion manual muscle test. Next, we're gonna move into hip abduction manual muscle test. So your patient will be in side line with the test hip facing upward. The agonist muscles that we'll be assessing here will be mostly gluteus medius, but there will be some gluteus minimus involved in this position. Okay, so first have your patient perform active range of motion for hip abduction. So Matthew, I want you to go ahead and raise your leg up for me. Good, and right back down. Good. So now I'm going to stabilize here at your pelvis, and I want you to meet my hand up here. Good, I'm going to apply some force hand, good, and don't let me push you down. Okay, ready? Hold, hold, hold. Good, and right back down. Good, and as always, test bilaterally. So Matthew, if I could have you just rotate here onto your left side. Good, so same thing here, okay? Go ahead and perform active range of motion hip abduction by yourself. Good, right back down. I'm going to stabilize here at your pelvis. Good, go ahead and meet my hand here, Matthew. Good, and hold, hold, hold. Good, excellent. Okay. Next, we will be measuring hip external rotation, active range of motion with the goniometer. So the axis will be lined up with the midpoint of the patella, and then we'll have the stationary arm perpendicular to the floor, and then your moving arm will be following the line of the tibia. So for external rotation, Matthew, we're going to take you this way. Okay? So go ahead and perform that on your own for me. Good. And come back. Okay. All right, Matthew, when you're ready, go ahead and rotate for me. Good. Good. So you are at 28. We'll go ahead and test bilaterally here. So we'll test your left side. Same thing here. Okay, Matthew, when you're ready, go ahead and rotate. Okay. 34. And then normal range of motion for hip external rotation for the goniometer is 0 to 45 degrees. Okay, next we're going to move into hip extension, active range of motion, measuring with the goniometer. Your axis is going to be here on the greater trochanter, and then your moving arm will be following along here, and then following the lateral epicondyle of the tibia. Okay, and then be careful just that your patient is not extending too much here in the lumbar region, but that we're getting more hip extension. So Matthew, I'm gonna hold you here, okay?
Good.
And I want you to go ahead and lift your left leg for me. Good, and right back down, okay? So I'm gonna be measuring here for you. When you're ready, go ahead and lift up. Good, and right back down. So that time he got 0 to 16 degrees, and the normal range of motion would be 0 to 30 degrees. And then as always, we would test bilaterally. Next, I will be performing a special test called the Overs test. And this test is to assess for contractures of the tensor fasciae latae, which can also lead to the tightness of the iliotibial band or the IT band. So you'll have your patient in sideline, and then the top leg will be the leg for the TFL that we'll be assessing. And then I'm going to go ahead and passively abduct and then put him into slight extension. So Matthew, go ahead and relax, and then his bottom leg is going to stay in this flexed position. Good. Good. So abducting the leg here, slight extension, and then our other hand will be fixating the hip here. Okay? And then after this, we are going to slowly drop this leg. Good. And then a positive test of the Ober's test would be that this top leg stays in the air, which means he possibly has a tight TFL or a tight IT band, which is not the case here. And then as always, you will test bilateral.